Hello, my name is Dr. Marcia Cruz-Correa, and I am the Executive Director of the University of Puerto Rico Comprehensive Cancer Center. I want to share with you some numbers about the burden of cancer in the island of Puerto Rico. Cancer is the first cause of death, and it affects over 17,000 new patients every year. The lifetime risk for development of cancer in the island is close to 42%. That is, 2 out of every 5 Puerto Ricans will be diagnosed with cancer during their lifetime. The total expenditures per cancer patient in Puerto Rico for the year 2016 was $1 billion. In contrast, the total Medicare per capita cancer-related spending in Puerto Rico was 42% less than in any other state of the Union. That is $20,000 per capita in the U.S. versus $12,000 per capita in Puerto Rico. One of the responses of the government of Puerto Rico to the cancer burden crisis was the creation of the University of Puerto Rico Comprehensive Cancer Center by Law 230 of the year 2004. This law creates a public corporation to execute the health policy for prevention, education, research, and clinical care in cancer care for Puerto Ricans. The main goal of the Cancer Center is to serve as a catalyst and integrate educational, community, clinical, and research resources focused on the eradication of cancer care in collaboration with the Department of Health. Another important aspect of this law is the fulfillment of the application to become an NCI-designated cancer center and join the other 71 cancer centers in the U.S., becoming the first Hispanic-specific NCI-designated cancer center. The mission of the Cancer Center of the University of Puerto Rico is to provide direct patient care, to provide research-driven cancer care, to advance health policy, and to promote education in cancer. We believe that health equity starts with access to resources, including financial equity, so that everyone has a fair opportunity to attain their full health potential. We need to provide access to cancer care. We need to provide access to approved therapies here in Puerto Rico, to measure healthcare outcomes, and to promote a culture of research-driven health policy and quality. We, together with the government of Puerto Rico, academia, and the private sector, can provide the best cancer care for the people living in Puerto Rico, including those participants of Medicare and those participants of Medicare Advantage. We will continue to work with the local companies to provide that access through contracts so that every patient that is part of Medicare Advantage has access to the Cancer Center. At this point, only 2/3 of those patients have access to the Cancer Center, but we will work together to make that 100%. Thank you for the opportunity to share with you these thoughts, and we look forward to continue to work with all of you, all the stakeholders, to provide the best care driven by research, science, training, and education for the people living in Puerto Rico. Thank you.